Hello, good people. Welcome. My name is Shiko Gitao. This is SPM Buzz, and I'm right here with Trudy Kitui from Trudy Kitui Media.
Yes, the queen of online media.
Yeah.
You forgot that. And this is our first interview together with Shiko, of course. I know you love us. 2026, you love us doing interviews together.
Yeah.
Yes, take it over.
Now, today we have an amazing guest, of course. At the end of 2025, a lot happened. I'm talking about the Scots. We're here with Nyasu and Scots. First of all, how's 2026 taking you guys?
Tunapambana.
Nyasu, nasema vipi?
We are getting there.
Yeah.
Sasa ndio tunajicollect tena. Yeah, we had a rough ride last year, but we believe this year things are going to be okay. Yeah, they're going to align.
But you're doing well?
Yes, we are doing well. Simna sasa tunanona, tunarudisha mwili.
And you know, it reminds me that when everything was happening, I remember there was a time we met at Komarok, and for sure,
We were confused.
Very confused.
we could tell.
We were very at us that your time we interacted at all. We didn't interact with you guys, but I'm happy that you guys are here.
Yeah.
Yes.
And we're also happy to see you guys right here. Pia tumeona mtoi doing very well. Congratulations, guys.
Thank you.
Yeah.
How is motherhood taking you right now?
I think because I was ready, I'm loving every bit. The baby has started smiling, so akinismailia tu hivi, everything just, it melts me. Yes.
After watu kuambia, it's been how many years you don't have a kid.
Exactly.
Ni tasa, blah, blah, vitu kama hizo. How does that make you feel when you look at your baby right now?
God
now
is
you're
not,
a mother.
I always say God is not a respecter of any man. And he made it right during his time. And akisema ni sai hakuna kupingana, so I'm just happy that he made it right at his own time.
Scott, fatherhood, you're a dad.
Me, I'm happy because I was waiting for this moment. I was ready. And nilikuwa natafuta, so vile nilipata, I was just happy.
Allow me to ask a question on the same, because Nyasu amesema pia God made it happen at the right time. Is it a situation of you were ready in 2025, or it was a situation of we are trying, but things are not working, we keep on trying?
So in 2023 we had our first pregnancy, but we had a miscarriage. So since then we have been trying again for a baby. And towards the end of December 2024, according to doctors, we were not going to get a baby. Yes, because I had done a process called HSG. We had done everything in short. Scott had done 7 analyses. And from now, everything, the rollout was we were not going to have a baby. So in January of 2025, we had already settled that it's not going to happen. But then in February, I missed my period. So it was just a short time, from December being told you're not going to have a baby, and then to January getting my period and seeing the last period of that year. Yes.
How did you take it when you were told that you won't get a baby at all?
By the time we are actually now seeking that option of let's go now to let's do a HSG, now let's do also semen analysis, it was like our last process. So we had already sat down and we were ready for whatever result that was going to come out, because it's something that we had kept on trying. So even when we were going to the doctors and everything, mentally we were ready for whatever the result is going to be. But we had not lost hope. Yes, we were ready, but we had not lost hope. Even after we came out and everything, there's a certain doctor who told us, most of the time when you're trying for a baby, when you're trying for a baby, most of the time the baby you don't get pregnant. So just go relax your heads. If you're looking for a baby, you do what is supposed to be done to find a baby, and relax, just wait. When the time is right, it's gonna happen.
Scott, how was it maybe for you when the doctors were like, it's not going to happen?
No, previously we have ever gotten pregnant, so I didn't have a lot of pressure. In my mind, I was thinking that the miscarriage maybe affected her or affected the whole process. So that's why we went to the gyna, we did the test, we did the x-rays and everything just to check out what is happening. So in my mind, I was 50-50. I was telling myself, if it will happen, well and good. If we don't get a kid anytime soon, again, it's okay. So I didn't have any pressure on my mind.
Then Then it happened in February.
Yes.
Pregnancy. How did you receive that?
Now, let me tell you guys
Yeah.
something. So, in the previous tests, that most of the time, especially after now that loss,
Yeah.
my period became very irregular. Like sometimes it would be so late and everything. So now, most of the time, when it was late, we used to test together.
Yeah.
But now this time around, that's February now.
Yeah.
Actually, we were in Valentine's. I was supposed to get my period around the time of Valentine. So we were in Nakuru, right? Yes, we were in Nakuru for Valentine's. I'm telling Scott, I really, really feel like my period is going to come today. I was really cramping.
Yeah.
And I remember even on the 14th, that day of Valentine's,
Yeah.
I actually prepared myself for periods.
Yeah.
Like unasikia vile una feelingi
Yeah.
period yangu itakam. Sasa kama unaenda kuzuru kushajiset like
Yeah.
ushajiami. So that's exactly what I did. Tukaenda tukapiga raundi, we went around nini. I come in the evening, my pad is clear, like there is literally nothing. So I told Scott, I feel like it's just late because I feel like my body is telling me my period is coming either today ama labda tu usiku.
Yeah.
So that day passed, the following day passed, we came back from Valentine's, nikaambia Scott, maybe I think ni vile nakuanga irregular. But now it took, after like 2 weeks, I was like, no, it can't be this irregular. But now I decided this time around, because of the many disappointments and everything,
Yeah.
I will test alone. Like I won't involve him.
Yeah.
So one day I just bought the test and everything, nikaenda kwa washroom, nikajifungia, nikapiga test yangu, hata I didn't check immediately. Nikapiga test yangu, and then I went to the bedroom sasa. Enda kwa bedroom. Napata 2 lines. At first I was like, I know. Ama ni vile mtu kosea. I was like, I know. And then I tested again because I was still in disbelief.
Yeah.
And then after I found out I was pregnant, I said I won't tell him. Like I won't tell him like right away.
Yeah.
But then I was unable to keep it to myself. So vile alikam jioni, nikaambia I have a little surprise for you and everything, and then I told him I was pregnant. At first alikuwa in denial. So akakam nikaambia I'm pregnant, blah 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 blah. And then now we did another test together with him, like the final one. Sasa ni kama vile mimi nimeona ndivyo yeye ameona. Yeah, the same day. Yeah.
And that was it.
Yes, that was it.
We go back now to 2025.
Yeah.
Now, here's the pregnancy. Journey ilikuwa vipi, especially for you, Nyasu?
I actually had a very, very... Okay, apart from the first trimester maybe.
Yeah.
Because around the first trimester, at around 10 weeks, after Sasa discovering we were pregnant, is when I got a hematoma. Hematoma is like damu around... yoka placenta or something, but it was managed because I was given medication and then I was given bed rest, and ikakuwa the pregnancy is okay. By the time we were going for a checkup, it was clear. So I'd basically say I didn't have a rough pregnancy. It was very, very smooth, very, very smooth.
Yeah.
Siku affectiwa sana na hizo morning sickness or anything. It was very smooth actually. Sometimes when Scott is going out, he'd go out with me. Like hakuna point pregnancy yangu imenisumbua by the way. Yeah, it was I think I had that smooth pregnancy.
Okay.
Yeah.
Let's hear from Scott. What do you feel changed when Nyasu got pregnant? Because of course mlikuwa mmezoea mkiwa nyinyi tu, but now ako na someone inside her. Do you feel it was a good for you? Alikusumbua kidogo, stress hapa kule? And we used to see the videos when mna post pale like you are pregnant. Yeah, tell us maybe how was it for you?
Me, I enjoyed the whole process. Kusumbua ilikuwa part of it because nilikuwa natafuta information hapa pale, so it wasn't that bad on me. And another thing, kwa hii house sisi, like when it comes to chores and everything, mimi wanachangamka. So even when she was pregnant, I told her not to do anything in this house, so I was taking care of everything. So I can say I just enjoyed supporting her, and I was there. Yeah.
Now it came time for you to receive your bundle of joy.
Yes.
Maybe you can tell us a little bit of how it exactly happened. Maybe from the time you felt like we need to go to the hospital each time.
Yeah.
So now, for my case, I actually didn't feel like I want to go to the hospital.
Yeah.
What happened is, from now the last the second last clinic, I had been told, since I was around 37 weeks, I had been told ikifika 40 weeks and I've not like had any sign of labor or anything, I should go to the hospital for a checkup. So around on October 27th, I was 40 weeks one day. So on October 27th, nilienda sasa for a checkup. And on going for that checkup, nilifanywa ultrasound nini. So from the ultrasound, the estimated weight ya mtoto according to the ultrasound was 3.7. And since my pregnancy did not have any problem, at that point akukuwa na a charge ya CS or anything. So the doctor suggested ukienda home mtoto atakuwa mkubwa sana. And sasa juu inakuanga +5 or -5, right? So assuming niko 3.7, nikikam home +5, that is around 4 point something kgs. So naona ni mtoto mkubwa sana. So daktari akasema, let's just admit you and we do an induction. So yes, that's what happened. So on October 27th, at around 7 p.m. I was admitted, and then at around 11 p.m. I was induced. Yes.
And a lot happened when you were ready to receive the baby and after the baby came, because of especially pale social media unajua watu ongea sana. A lot was said after mtu alikuja, you shared your story and they were like, Nyasu aliambiwa azae like CS and now she wanted normal nini. So I don't know how it was. Maybe you can clear that and take us through on what happened.
So now on October 27th I have been admitted, right? And at 11 I have been induced. So the method they used for induction was, I don't know if it's the right word.
Ballooning.
It's called ballooning. According to them, it was sijua mechanical method plus, it was wali combined sijua mechanical plus what. So now they did ballooning. Ballooning niliingizwa like catheter ikiwa na, I don't know, sijui kama ni maji ama ni nini. So waliniingiza catheter kwa cervix kusaidia kufungua cervix, because now you know I'm not laboring. So it's kusaidia ni dilate. So according to them walikuwa wameniambia ukifanya ballooning tutakuweka balloon and then you'll have to walk around hadi sa balloon itaanguka, then we do the first membrane sweep kuna umedilate how far. So that's what happened
At 11?
at around 11 p.m. sasa usiku. So wakanifanyia ballooning and then of course nikatembea nika walk around usiku bado nika walk around nini. My friends were there, my sister was there, he was there. So at around after like 45 minutes roughly the balloon sasa ikaanguka kuoneshana imeshafungwa cervix. So nikafanywa sasa the first membrane sweep and I was 2 centimeters dilated. And then sasa we were also given shots za a certain liquid. Scott alikuwa ananifaa kunipatia after every 2 hours 25 ml. So 2 hours ikipita Scott ananipatia the liquid kwa ilikuwa na syringe something like that, si ndio? Nipatia 25 ml after every 2 hours. So sasa nikifanywa the second membrane sweep I was about 4 to 5 centimeters. And at that point now, because hiyo time yote there is nothing that is getting into my mouth inakaa. So nakula na throw hata maji. Nakula na throw up. Hata niseme tu ni kutaste tu. Nakula na throw up. So at around 4 to 5 centimeters, I started feeling like I don't want to do this. It's like it's too much pain and then I can't put anything in my mouth. Already I'm in the back of my head I'm regretting whatever I'm doing. So nikambia the nurse that I feel like I want a CS. Actually nilianza na kuambia Scott, sioni kama nitaweza. I feel like at around 4 to 5 hapo. 4 to 5 centimeters. Juu hata wako ananiambia uko 4 ama 5. Nilikuwa naambiwa hiyo 4 to 5.
You know the stories out here is that Nyasu alikataa CS.
No. I actually asked for a CS at around your 5 centimeters. So I told Scott I feel like I really need a CS. Na hata vile nasa aliingia huyo na sosiku, I told her I really feel like I want a CS, but akaniambia your labor is progressing well, there is no need for a CS. So si mimi nikasema sasa kama hakuna CS I really have to be strong. You understand, yeah? So I labored and throughout the night the nurse was checking my vitals like BP, the pressure na pia heart rate ya mtoto. So throughout the night everything was just fine. BP yangu ilikuwa sawa na heart rate ya mtoto ilikuwa sawa.
Was the labor that much for you to
It
handle?
was painful, like it was, I wouldn't, if I was to go back in time I would never have chosen induction.
Yeah.
Hata tunakitingi tunaambia na Scott, maybe we should have waited ijilete tu naturally, right? So now asubuhi imefika sasa, shifts have to change.
Yeah.
Daktari wa usiku si yeye daktari wa asubuhi. So at around 7 at around 6ish hapo,
Yeah.
the nurse akakuja kucheck huyo usiku sasa, akakuja kucheck vitals zangu.
Yeah.
Everything was okay, BP ilikuwa sawa, heart rate ya mtoto ilikuwa 158, which is a good, because inakwanga in between 120 to 160, right? So heart rate ya mtoto ilikuwa tu sawa, ilikuwa 158.
Yeah.
And then I told her, because I feel like huyo nurse usiku alikuwa, she was very nice actually. She was, at your time ananifanya membrane sweep, I could tell her I'm feeling this way and she'll be very very patient.
Yeah.
So I didn't want her to go. I really didn't want her to go. So your time ananiambia someone else is coming for the shift, I really begged her, nikamwambia by the time inafika 12 nitakuwa nisha deliver, si ukae na mimi tu hadi hiyo 12.
Yeah.
Akaniambia hapana, no, okay, I can do that because shifts have to change. But I don't know why I was feeling like nilianza to I really want her around. So now akaniambia she really has to go, but ataniletea mtu atakuja kuniintroduce ya mwenye, atanitackle from there.
Yeah.
So she brought a young guy, a nurse. He was a nurse, right? Akaleta a nurse, akaniambia sasa huo ndio atakukari from here sasa all the way to when you'll deliver, but I promise you by 12 utakusha deliver.
Yeah.
12 sasa ya noon utakusha deliver. Nikamwambia there is no problem. So now remember this person, the nurse at night alikuwa ananicheck vitals, alikuwa na make sure kama ni 2 hours ni 2 hours, kama anafaa kufanya membrane sweep at 4 hours ni 4 hours, she's there at 4 hours. So hii shift ingine imeingia sasa, and I was supposed to get a membrane sweep at around 8 ilikuwa 8:50 something hapo, 8:52 jina kumbuka. After every 2 hours ilikuwa inakuja na 52, ilikuwa inafika like kama ni 9 ilikuwa inafika hivyo 9 ilikuwa inakuja. So it was around 8:52 ndio alikuwa nifanyie membrane sweep wakipima heart rate ya mtoto. Basi ikafika 8:52 akaniambia just get ready nini. So basically nilifanywa hiyo sweep ya mwisho around 9:30 hapo. So 9:30 nikaambiwa sasa membrane sweep unajofanywa kwa ward unaenda kwa delivery room. So nikaenda kwa delivery room, wakanipima, wakanifanyia the sweep. But actually now remember unaso usiku alikuwa ananisikiza sana. So unaso usiku nikisikia ni kama the contractions are going away, she used to do the sweep like ndio nisisikie uchungu sana. So now this person, the nurse wa mchana na walikuwa na daktari fulani, I don't remember his name. So it's 2 guys sasa kwa delivery room. I tell him nasikia contractions zimeisha, nifanywe sweep sasa kama sasa hivi zimeisha. Because at this time sasa contractions ni mob, like hazinipatii hiyo space ya kukaa for long. Zinakuja like back to back because now the baby is almost here.
Yeah.
So ziko back to back. Nikamwambia I really feel like contractions zimeenda, nifanyie sasa sweep sahi. And then he's just chilling. Like they're not even responding. But the Scott was there, they're not responding. So anaona amechukua ma gloves anafanya like they just slowing around. So contractions zikarudi. Contractions zimerudi sasa ndio ananifanyia sasa sweep. So it's painful. It's painful as hell. So akanifanyia sweep, akaona niko 8 to 9 dilated, 8 to 9 centimeters. Basi sasa after daktari amenifanyia sasa sweep, nasi anafaa apime heart rate ya mtoto. Heart rate ya mtoto imedrop drastically from 158 to sasa ile 115.
So it's even below.
It's iko chini, like iko chini kabisa. Imedrop. No, hiyo ni a drastic drop because from 158 to 115 in like 2 hours, that's a drastic fall. So now, according to me personally, I feel like hiyo ndio point walifaa maybe ku request for an emergency CS, right? but that didn't happen. So wakanirudisha kwa ward. Sasa kunirudisha kwa ward wakaniambia kuna liquid fulani watanieka ya kusaidia kupandisha heart rate ya mtoto. Ati heart rate ya mtoto saa ingine yushuka as mtoto anashuka. That's what they said, yeah. As mtoto anashuka saa ingine heart rate to drop, so wataniekea certain fluid ya kupandisha heart rate ya mtoto. So they put, sasa wakanieka hiyo IV nini. I don't remember your liquid what it's called nini. So they put it, but now as wananieka hiyo liquid, si tuko kwa ward tena, I really feel like pooping, like nasikia hiyo aja kupupu. So sasa nimeanza kusema nasikia kupupu, ananiambia hivyo ndio tunataka tusikie, tunataka you're almost there, so that's how you're supposed to feel.
So they didn't react even like
immediately. Unajua mtu akisema nasikia kupupu, hiyo sasa ni mtoto anakam. So mimi naambia nasikia kupupu, and they tell me hivyo ndio unafaa sasa usikie, you're almost there, you're almost there. Wananibounceisha kwa hiyo the yoga ball.
Okay.
Yeah, it was 2 nurses, a lady and a guy. So wananibounceisha kwa the yoga ball. Sasa wananiambia you're almost there, and then pia wananipatia uji. Remember sijakula anything throughout the night, so hata sina nguvu. So I kept on saying I feel like pooping. I think after nimesema hivyo for a while, wakasema ama tuende tumwangalie tena. So now that's when they took me back to the delivery room. But sasa hiyo time sikufanyiwa sweep, juu already nimekatu hivi kwa bed, wanaona hairline ya mtoto.
How long maybe did you stay, like ukiwaambia you're feeling the urge to poop?
From sasa hiyo the previous sweep, so you're 8 to 9, ilikuwa around 30 minutes. 30 minutes. So around sasa hiyo time ndio kanipeleka delivery room. But sasa hawakufanya, so nilirudisha delivery room kufanya sweep. But they can't do the sweep because mtoto anatoka. So they call a certain midwife. I don't know if she was around ama sijui alitokea wapi. Sasa I don't know, from there like ilikuwa na tu vitu zina move very fast. So I don't know if she was around ama alikuwa nje, juu alikuwa tu hapo sijui. Alafu your time, a lot of doctors and nurses started getting in, like into the delivery room. So the midwife anaambiwa na huyo na sasa mwenye alikuwa ananihandle, ebu mtoto sijui alimwambia aje, but according to the midwife, the only statement we had was, so you book her for a CS. That was her statement. So she comes, alafu the nurse tells her, si wewe kuja uangalie situation mwenyewe uone. So amekuja huyo the nurse, the doctor amekuja ananiambia, and the next thing nasikia ni start pushing. You understand?
And they didn't even take in action after wameambiwa you book her for the
so there was no CS.
Okay.
So amekuja as a situation, alafu ananiambia push. And then sasa of course it's my first time pushing. So of course hapo nilimiss the right way of pushing. So akaniambia no, relax, that's not how you push. Of course akaniguide, akaniambia that's not how you push, this is how you push. So sasa na push. Alafu now I was kind of confused because the doctor is telling me push, and then the nurse that is on this other side is telling me usipush kama hau contract. So contractions ikiisha una relax, unangoja contraction ikuje, time contraction imekuja ndio una push. So hii side naambiwa push, hii side ingine naambiwa kama contraction ijakam relax, usipush.
Scott, were you around when
I was there. I was there since the process started hadi mwisho. So hapo time tunafanya nini? I can say this, we asked for CS almost 3 times, but nobody was telling us. Like I can say the nurses were more concentrated on the dilation. Walikuwa wanasema hujafika 10 cm, uko karibu, umetoka mbali, just vumilia, uko karibu. So that was the talk. So they didn't even tell us mnaweza enda CS, mtafanya hivi, because after that when I'm being called for a meeting the next after some days, na uliza mbona mkutupea CS, or what do we do so that a customer hata kama si Nyasu anafaa kukuwa na hiyo right ya kupewa CS. Akasema mtu akiuliza utapewa. Nikauliza mbona sisi hatukupewa basi, if it's just to ask, because if it's payment and everything I could pay that. So hatukupewa CS. Na the first red flag was that heart rate dropping.
Maybe after you felt those red flags, amkuitisha referral, maybe go to another hospital.
No, so now everything was happening very fast, and we were first-time parents, so we were just trusting the doctors. But I was asking, even the moment she started pushing, cause Nyasu alipush karibu mara 5 ndo mtoto akatoka. Juu kichwa ilikuwa inaonekana inarudi ndani, so it was like hide and seek. I'm seeing the airline inarudi. Hadi nikauliza kwani huyu mtoto achoki? Juu sasa this is like hide and seek here. The nurses are just saying mtoto atatoka tu. So I saw the red flags there, but sasa hiyo time everything is happening. There's nothing you can do. I don't have any experience, but I saw the red flags. Yeah.
And now for how long did it take ndo mtoto akakuja sasa? Yes.
So nikapush and then at some point, remember I had not eaten anything at night.
Yeah.
So sasa hata mimi nasikia sina like nguvu inaniishia like kabisa. So I'm pushing wanaona mtoto but mtoto hatoki. So they said why apply a certain method ya kusaidia kupush mtoto outside because mtoto anakaribia kutoka hivi anarudi. So that's when sasa wali decide wani press. Like there were so many doctors by the way. There are almost 8 doctors in that room. Sijui ni doctors mixed with nurses. There are so many people. So mmoja kanilalia side, mwingine kanilalia side. Alafu sasa kuna wana sana ananiambia push, like nikisikia contractions ananiambia push. So wakanilalia ni nini. But as huyu wa side anani press, I'm telling her I'm feeling pain, like vile anani press nasikia uchungu. And for some reason sasa nikaanza kusikia I'm finding it difficult to breathe. So nikaanza kuambia I can't breathe. I think hiyo ndio point walinika kwa oxygen, right? So they put me on oxygen. Alafu cause I had not, like I was still very hungry. Na sina nguvu, sina hiyo energy, walikuwa nipatia I think shots za glucose. So kwa mdomo niko na naekewa glucose, kwa mapua niko na oxygen. Alafu sasa huku na push. Una get? Like it was so many things happening at the same time. So nikapush. But now when the baby now finally came out, naekelewa mtoto, I don't know if she was blue ama ni color purple, I don't even, but ndakumbuka tu nikiuliza daktari mbona ajalia, like why is she not crying? Mtoto hakulia completely. Like mtoto alitoka hata she was I don't know if this is the right word to use, but she was like a dead person. Like alitoka, she was floppy, like alikuwa tu hivi. Nikauliza mbona mtoto ajalia? And then immediately nikaangalia Scott. I don't know, Sarah sijui what happened. Nikajipata nimeangalia Scott, nikapata Scott ana tear up, like analia. At that point, alafu wamechukua mtoi. So unachikia the golden moment where a mom like holds the baby and everything. I didn't get that. So wamekelea mtoi kwa bedi yake, wanampiga like hiyo kutry. Sijui kumtry kumfanya alie, mtoi halii. Wamemeka hapo hata sijui nini ilikuwa inaendelea. Alafu sasa mimi already nishaanza kutolewa placenta. Like a lot is happening at the same time. Natolewa placenta. I'm asking them, mbona mtoto ajalia? Huyo daktari mwenye anahandle mtoto yuko ananiambia concentrate side nyingine. Utolewe placenta na utolewe clots. So I don't know, I feel like hiyo Scott ndio anafaa explain hapo like what was happening on that other side kwa bed ya mtoto because hapo hata sikuona.
Yeah, so when the baby came out akulia, na see everywhere tumesikia mtoto akitoka lazima alie. So for me when niliona mtoto ali, I was like, what is happening? Ama huyu mtoto amefanya nini, amekufa? So wakajaribu hiyo mambo ya kumresuscitate, mtoto akulia, hakuna anything. So the next moment tunaambiwa nini, nikaona wameshika mtoto, tunakimbia wapi? Kwa nursery. Kwa nursery wanasema huko ndo sasa kuna the gadgets and machines to help her maybe to come back, si ndio? So mimi nikavaa gloves pia because even the same time tukikuwa hapo Nyasu alikuwa like neglected, alikuwa huko. So I just took on gloves, nikajaribu kumsaidia kae poa na tukakimbia kwa nursery. So vile tulifika nursery, the same thing, doctors wakasurround mtoto. Doctors kama pia tu 9 or 10 because so I wasn't seeing what was happening because nikakuwa ile glass. So kusimama hapo like after kitu 1 hour hivi walikuwa tu tunasimama hapo, nikaona mtoto anasongesha tu miguu. Ndio sasa nikaona hakuwa amelia mtoto alilia
after 1 hour 30 minutes.
Mtoto akulia. So hiyo time
miguu like hiyo time ana flop miguu, she was still not crying.
So vile niliona miguu zikiflop nikaona kuna life, kuna hapo life. So mimi nikasimama tu hapo. wakamaliza wakamweka kwa oxygen, wakamwacha hapo kwa nursery bed. Ndo sasa nurse akatokea akakuja kaniambia mtoto alikunywa uchafu. Aliniambia tu mtoto alikunywa uchafu ikaingia kwa lungs, we need a certain medicine, na hii medicine hatuna, it costs 40,000, na tusipompea mtoto hata survive. So that time mimi pia nauliza hii dawa hamna hapo mpee, cause I didn't have that money hapo kwa hiyo hospitali. So mimi kitu nilifanya, nikapiga simu, nikatumia do, nikalipa. Wakati nililipa ndo akaenda akapewa nini, hata siku ingia tena, wakaita Nyasu. Hii time yote nilikuwa nimeacha Nyasu kujua anatolewa placenta, so hakuwa anajua what is going on. So nikaambiwa lazima mkoe hapa, tukifanya nini, tukitoa uchafu na tukiadminister hii dawa, mkoe kama witness. So Nyasu ndo aliingia ndani, akaona wakipeana hiyo dawa. So huyo mtoto amekuja kulia sasa after hiyo uchafu imetoka. Sasa ilikuwa kitu 1 hour 30 minutes ndo mtoto akalia sasa, the first cry.
Yeah, there could be someone watching na nauliza labda hii uchafu isipokuwa administering the jab yenye ulisema ilikuwa 40k, is there anything that was happening?
Hiyo time in between
No, when you were called mkaambiwa lazima mkue hapo ndo atolewe uchafu. Isipokuwa
alikuwa tu kwa oxygen hiyo time. Vile tuliona miguu ikisonga, the only thing they did waliweka kwa oxygen na akakuwa pale kwa hiyo NBU. So the only thing, the kid was on oxygen na maybe fluids juu sasa akuwa amenyonya, cause hiyo kunyonya kwa, so alipewa fluids na akakuwa kwa hiyo oxygen. So akasema hiyo oxygen ndo inamsustain tu hiyo time, tukingoja dawa ikuje juu akitoka kwa oxygen hivi angeweza kupumua kivyake. So angemtoa kwa oxygen angekufa.
I was asking about process ya wanasema alikuwa amekunywa uchafu. What do they exactly do kutoa uchafu?
I really don't know how they toa the uchafu. But what I know, mtoto akiwa amekunywa hiyo uchafu, like they are not able to breathe. Juni kama uchafu imeenda kwa lungs, right? So they are not, like babies cannot breathe. So I think there is, I don't know if it's a suction, whatever that they use to kutoa uchafu, but kuna vile wao hutoa hiyo uchafu. Yeah, so mimi hiyo time wakitoa uchafu I wasn't even there. Juni nilikuwa bado na cleaniwa. Remember ndio nimedeliver, so they have to like remove the cloths, wanitoe cloths, wanitoe placenta, and then now I go back to the ward, I shower and then I change. Ndio sasa nikaambiwa you have to go and watch witness sasa akidungwa hiyo the surfactant sasa hiyo ya 40,000.
So mtoi alirudi sawa after kutolewa uchafu?
Alitolewa uchafu and then that same day, okay, she cried, after like 1 hour 30 minutes she cried, but not the rest of the entire day, like she was very fussy. Like kila time tulikuwa tunaingianga niku, hata like tukitembea towards the niku, tulikuwa nasikia mtoto akilia. Kila time tukiingia ni mtoto wetu analia. So she was very very fussy, like alikuwa analia sana. Hata even when family, hata tukitaka kuambia mtoto utaangalia mtoto hivi, tulikuwa namwambia wewe ende NBU, akakatoto utasikia kilia, ako ndiko ketu. So she was very very fussy for the rest of the day after pia ametolewa uchafu na nini.
Was there like an explanation as to why maybe alikuwa analia sana?
No, we were not told why she was that fussy.
But you like mliwaambia kulikuwa na like hiyo story ya kulia?
Sasa during the meeting cause cause sasa now si unajua mtoto amekaa sasa kwa ameshapatiwa hiyo surfactant sasa, but she's very very fussy and everything, and then we were told vile mtoto ako fussy hivi. That day she was really really fussy, and I think the following day she was also very very fussy, because I remember the following day mtoto somehow alikuwa anaweza kutoka kwa oxygen, si ndio? Alikuwa anaweza kukasa bila oxygen. So alafu alikuwa anafanywa kitu ilikuwa inaitwa I think cold therapy, like mtoto wetu hakuwa anahitaji a lot of heat, like alikuwa anafanywa cold therapy. I think I don't know how that helps or anything, but alikuwa anafanywa hiyo cold therapy. So the following day tulikuwa tumeambiwa mtoto ako somehow anaweza toka anaweza kaa kwa room temperature, at some point ataletwa kwa room, sasa nikae na yeye. But sasa the following day jioni tukaambiwa vile mtoto ako fasi hivi hatuwezi taka kumleta kwa room juu atasumbua sana usiku. Wacha kwanza to observe, and then when she's not crying and everything, then now we can bring her to the room. So now that's the following day after nimedeliver, right? So now after hiyo siku na hiyo siku ingine after nimedeliver, the third day after I have delivered, she got her first convulsion. Convulsion ni kama it's seizure like, yeah, it's like a seizure where like watoto mostly you stare like from vile ya ali seizure hapa kwa nyumba sasa, wao stare and then they make like a very weird noise like si ile kulia kawaida. So now she got her first convulsion na I think hiyo siku akapewa anticonvulsant, right? So amepatiwa anticonvulsant, nimeenda. Remember this whole time I'm not being told mtoto kuna kitu amefanyiwa ni nini. So mimi natoka kwa room naenda niku naambiwa mtoto ameconvulse, tumempatia dawa. Like kuna chiki vile una at least una update mzazi because I'm in the ward. Una update mzazi unamwambia mtoto ameconvulse, sasa tunataka tumpatie anticonvulsant. There was no that. So nilikuwa natoka kwa room napata tena mtoto ako kwa oxygen. Uza mbona tena ako kwa sijaambiwa amerudishwa kwa oxygen. So I was feeling like there is no communication, there is nothing. So nauliza mbona mtoto amerudishwa kwa oxygen and you guys are not even telling me. Like mpaka ile time nitashuka ndio mniambie mtoto amerudishwa kwa oxygen. So now when I asked that wakaniambia mtoto amewekwa tu, tulikuwa hata tukwambie mtoto tumemweka kwa oxygen saa hii tu kabla ukam ndio tumemweka kwa oxygen. So I had that out like I really need you guys to communicate because I'm a parent and it's so bad. It's so bad that this is my first baby and then there is no she's sick, there is no communication. So after amepatiwa sasa hiyo anticonvulsant nini, on the fourth day sasa si mtoto anafaa kukuja bedside observiwe sasa from bedside. So they told me that alafu remember this whole time my baby is not breastfeeding.
Whole time.
Yeah, on fluids. She's on fluids.
Okay.
So she's on fluids. But now on that third day hiyo ako convulse, nilikuwa nishaambiwa ni pump maziwa. Mtoto aanze sasa kufeed maziwa. So mtoto ameconvulse, nikapeleka maziwa. Nikaambiwa amepatiwa anticonvulsant. Hiyo time hata sijui kuconvulse ni nini. By the hiyo time nikiambiwa mtoto ameconvulse nimempatia anticonvulsant. I don't know what a convulsion is. So I was like, oh, maybe it's kuna kitu imehappen, amepatia dawa, she is okay. So I didn't know convulsions ni like seizure, like it's ni kitu serious hivyo. So niko like, oh, she's okay at least. So nimepeleka maziwa, nimepeleka maziwa. So now the baby, remember mtoto, hiyo the first day vile alitoka, she really wanted to breastfeed. Alikuwa dia anafanya mdomo hivi like ni kama anataka kunyonya, but haizi nyonya cause lazima atolewe hizo nini the meconium na lazima atolewe hiyo surfactant. So mtoto ako on fluid, so haizi nyonya. So in the process mtoto akasahau kunyonya, like ajui kuvuruta sasa cause they forget. Mtoto akasahau kunyonya. So now I'm being told we will engage an occupational therapist afunze mtoto kunyonya uende naye home akijua kunyonya. So on that fourth day sasa Scott ndio alifanya on the third day ndio alifanya the video ki explain that mtoto this and this has happened. So I don't know if it's the video that made vitu zianze sasa kuharakishwa or anything. So si mtoto anafaa kuja bedside, she didn't come to bedside. So si ameconvulse the third day, the fourth day wanamuobserve jo aliconvulse jana, wanda kama ataconvulse tena. She didn't convulse, jo alikuwa na anticonvulsant, alikuwa ameshaekwa anticonvulsant. So now on the fifth day, which was on a Friday, remember I've delivered, I came to the hospital on Monday, nime deliver on Tuesday, sasa this is Friday. Friday nikaambiwa mtoto saya kwa sawa, we are going to discharge you guys today. Niko like, so now what am I supposed to do? She's not breastfeeding.
And you want to discharge?
Sijafunzwa bottle feeding, mtoto bottle feed. Si alikuwa na feed huko ndani na syringe. Mtoto sijui bottle feed, her breastfeed.
At this point ako bado under oxygen ama sasa anaweza
survive. Ametoka kwa oxygen sasa. Sijui breastfeed na sija have bedside, like hawajamleta kwa bedside, wamuobserve kwa bedside. Alafu kaniambia hiyo siku wa mtoto aliconvulse, so niniambia atanipatia certain medication nikuje nayo home kusifanya asikue na future convulsions. So nikudischargiwa sasa. At this point I think I'm so confused. I feel like a lot is happening at the same time. I didn't even argue. You understand? So hiyo siku on Friday sasa we were discharged with a baby that does not know how to breastfeed and a baby that does not know bottle feeding. There was no like yatukulete yangu your therapist.
Yeah.
So sasa tumekuja home sasa anahitaji kufeed. Actually most of the time like hiyo time tulitokana na mamangu Hosi, yeye ndiye alikuwa anangana kumfeed like na bottle.
Yeah.
But mtoto ana use the suckling reflex. So anamwekea and then she still also I think doesn't know how to swallow, si ndio? So kuna vile unamshika ndio ameze. So now on Friday we were tukarelease hiyo siku mamangu akamfeed. Actually on Saturday she came as well. Tukashinda na yeye. And then sasa on Sunday which was I think was on the 3rd of November. On Sunday jioni tumerelax tu. Actually akipata the first convulsion Scott was not around. So now akipata the first convulsion alitoa hiyo the weird stair place. Actually alianza na the stairs. So sisi tunashangaa we are jokingly saying akaka napenda kuangalia hii place atujui ana convulse. Sasa hizo ni kama silent convulsions. Tunasema amekausha kichwa hataki hata kutoka kwa hii curtain anaangalia tu curtain. And we are laughing about it. We don't know it's a convulsion.
No even blinking.
She's not blinking. Uwezi mtoa hiyo position like ako hivi alafu amejikausha. So andaliyo time ako anakausha mostly it was the head that ilikuwa ina Stephen. Aya, so sisi tumeshinda tukisema hivyo at ulitoka hapa kitu 5 right kwenda Resamble or something, you are going to get a few things. So tumebaki hapa sistangu mamangu nini, and then at around 7:30 she made sasa hiyo stair place. Alafu akaangalia alafu alistia hii curtain actually because I was seated here. Akastia hiyo curtain and then my sister's sasa baby was passing around. So tukadhanini mtoto amefanya aliye hivyo like ni kama alibehave ni kama ameshtuka ni ile kulia ni kama mtoto ameshtuka. So we told my sister told my nephew stop playing around her because she's still a baby, saying anaweza shtuka. Sisa ameconvulse sasa hiyo sasa ya kutoa hiyo sound. We didn't know it's a convulsion but I could tell something is wrong. Like my intuition is telling me no, a baby does not cry like this. And then the stairs sasa ndio zikaanza kuniambia hey no, it doesn't work like this. So at around 9:30 Scott alikuwa shaka nini tumekula dinner. At around 9:30 Scott akamchukua kumfeed, but akimfeed akamake that cry again and that stare. Sasa walikuwa bedroom. Nikaenda nikaambia Scott, unajua hata sasa mara ya kwanza amefanya hivi, at around 7 bado amefanya the same thing. So sasa Scott akaniambia acha ni muobserve nijue vile tutafanya. So everyone left, tukabaki sasa mimi na Scott. Usiku at around 12 tumeenda kudoze. Mtoto sasa ziko consistent like anakatu hivi hata ikai hata sijui how many minutes ashaanza kuconvulse tena. We called our friend tukamexplain this and this is happening. Akatuambia acha niwapatie bishti yangu ni friend ni daktari mumuulize. Daktari ndo akatuambia those are convulsions, go to the hospital. So ndio tukaenda kwa Rock Modern. So but the same night on Sunday night. But sasa remember ni usiku hakuna pediatrician usiku. So tukaenda akadungwa tukaambiwa atadungwa certain medication, tukamnae home. Hiyo dawa ni ya kumsaidia tu alale like aweze kukua calm like the night, and then very early in the morning we go to the hospital sa pediatrician akiwa. So we come back and then in the morning of course tunajitayarisha nini. By 11 we were at the hospital. So tumefika nini tumenasa kwa pediatrician. Pediatrician anaangalia hivi mtoi ako like what? Mtoto ako mbaya. So pediatrician akachukua mtoi akakimbia naye kumweka kwa oxygen because she was bad. Like hata before tongele money or anything, the child was on oxygen nini at least akasema amestabiliziwa. Akadungwa I think pia phenobab, si ndio? Akadungwa hiyo dawa phenobab kabla kabla tuendelee na hii story, wacha mtoto kwanza akwe like stable. So ndio mtoto akakimbizwa kwa oxygen nini. Alafu of course the doctor akasoma report ya the previous hospital. Alafu Scott akaambiwa pia aende sort out uko kwa finances as sasa mimi nimebaki tukiongea na daktari and everything. So that's how she was admitted at Komarok.
Okay, after that how long now ndo mtoto akarudi akakuwa sawa ukafeel now you can go home?
So now what pia at Komarok tulika for a while cause sasa tumeenda according to the doctor mtoto alifaa kukaa kwa Phenobab at least 5 days. Hiyo the anticonvulsant.
Yeah.
So akaikuwa on Phenobab on IV for 5 days. And then remember tukitoka Haven I had been told that nitapatiwa dawa fulani ya kuzuia the future convulsions.
Yeah.
So now hiyo siku tukitoka Haven I was given a certain medication inaitwa Ampiclox. Ampiclox is an antibiotic, right? So as tukikuja na Ampiclox tunadhani Ampiclox ndio ya convulsions. Tunadhani ndio ya convulsions. Juu tulikuja hata sisi ndio tulijidilute tukaeka kwa fridge. So tunadhani the Ampiclox ni the anticonvulsant. All this time we don't know it's not the one. That's an antibiotic. Because also she juu kuswallow hiyo the meconium alipata the neonatal sepsis.
Yeah.
So it was I think the antibiotic for that. It wasn't for convulsions. So I think kwa meeting ndio alikwambia sijui what did they tell you?
So they called you for a meeting mtoto akiwa bado Komarok.
Okay, so wakati tulikuwa discharged, me I just went online asking for general or it's called public knowledge.
Yeah.
I didn't sikuwa nataja hata anyone. I was just asking mtoto akifanyika hivi what do you do? What do you administer? So people were giving me the way forward. I was going through the comments, people were saying what they were saying. So after those videos, that's why I was called for a meeting kwenda kuexplainiwa. So one thing from the start, mtoto akiconvulse anafaa kuwa kwa medication even for a week. Wetu alipewa dawa moja, alipewa like ni tumbo inamuuma, you just administer like a painkiller and it goes away. Because our kid alikuwa na hiyo, aliconvulse na pia alikuwa na neonatal sepsis, hiyo ni infection. So the both scenarios, someone should be treated like for 5 days if it's minimum. 5 days you are on that medication, 2 days for observations. Waone mtoto wako aje. But sasa unaona wetu alishughulika 1 day. Na hata tukiitwa huko chini na nurse alituambia huyu mtoto ameconvulse lakini tutakuwapea dawa nyingine muende home, you check out for this and this na mtakuwa mnampea hii. Na even the day tunakuwa discharged nikipewa hiyo dawa nilirudi hadi juu kwa doctor nikamwambia hii ndo dawa ulikuwa unasema itachenjiwa into syrup ndo ikue, akasema ni hiyo. So the moment I'm being called for a meeting wananiambia ati sisi vile mtoto aliconvulse mara ya kwanza tukampea dawa tukaona ako stable, we didn't see the need of going on with the medication. Nikamuuliza mbona hukuniambia or why did you not tell us because we are the parents. Akasema me as a doctor that was the right decision. So in that meeting they just explained everything that went on. Even nakuja baadaye wanasema ati mtoto heartbeat ilipanda. Ati wamerecord mtoto heartbeat ilipanda to 124. At the moment they administered the drugs on Nyasu ilipanda. And me I remember tulipima hiyo heart rate mara kadhaa. Haikuwa ina move. Cause hata ndo ule madama kuja aseme CS, the nurse on ground alikuwa explain akamwambia we have this situation and this situation. So it's like you're explaining to a more experienced person. So even the nurse saying that we should do emergency CS, things were not going on well. But sasa waka-assume too, they recorded their things on paper. So even when they are calling me for a meeting ilikuwa ni kama hao wameshajipanga wanataka kuniambia chenye wataniambia na mimi ni kwetu hapo kusikiza. By the way went nikawasikiza nikamwambia for now let me just check out my kid. Wakati nitamaliza everything I'll come back for another meeting.
So they called you for a meeting after umeshaongea online?
After nimeshaongea online. The time I was just doing public knowledge. Hata sikuwa nataja tulikuwa hospital gani. I was just asking like ile design tu nauliza anyone can ask. So those videos went viral na wakaniita. So vile wameniita hiyo meeting there's nothing even they explained for me that made sense to me because that time ndo nimekaa usi hata 1 week tulikaa usi another 3 weeks. Tulikaa 1 week Haven, 3 weeks Komarok. So like I was in 1 month tulikuwa usi. So hata vile tumekuja Komarok there's a lot of things the doctors there were saying hizi haikufanya poa. Even when you go to comment section madaktari even doctors were reacting on those videos saying what was to be done, what was not to be done. But sasa Haven at the end of the day they were telling me as we did the best we could do. So mimi niko nauliza mimi kama mzazi mbona mko mnanipea update because you are just doing things on your own because you are saying that is best for the kid. Unaona mtoto I'll end up if this kid was okay the moment we were being discharged. Mtoto angekuja kukaa Komarok another 3 weeks. because the moment you are discharging a person inamaanisha mtoto akosa. Hata mimi wakati tulikuwa tunaenda Komarok tulikuwa nadhani tutapewa tu dawa turudi home, lakini sasa vile tunafika Komarok it's another story. So you see at the end of the day there's some problems suppose zenye si hatukuambiwa. Na at that moment even watu walikuwa wananiambia, watu walikuwa mimi nilitoka Niku, nilikaa na mtoto wangu siku 2 akakufa. So that's what was coming on my mind juu pia sisi kama tunge react. Of course vile tulitoka kwa Friday, maybe mtoto by Monday angekuwa amekufa. It's just because we were on the lookout and we went back to the hospital. So at the end of the day having the accountability was there. Our walifanya the best according to them. So mimi at the end of the day that's why I told them there was negligence na kuna vitu hamkuwa mnatuambia. Because kama mtoto wetu akona hii shida tuambie. We were the one who were paying by the way. Sisi ndio tulikuwa tuna spend pesa. Because we collaborated for them just for the service and for the room. So after there anything else that happened I was paying. Hizi zingine si ati walisimamia after there too. So if tungezaa tu poa without any complications, hiyo ingekuwa sawa on their side. But now when the complications came in, walijitenga wakasema juu mnafaa mshughulikie na this is real time. So hisi kitu kuambia mtu ati nitalipa baadaye. So we were paying real time. So one thing I feel my kid was discharged kama hajamaliza medication na kama pia hajakuwa sawa. So nikiwaambia hivyo wako wanasikia. Now hiyo time yote, that's why you see all this time I was the one just talking because Nyasu wasn't even in a position to talk. Because after everything happen ndo hiyo akakuja akalose maziwa, hakuna maziwa, mtoto ndo huyo ajui kufeed. There was a lot of things that was happening in the process. And when we came to Komarok, kuna kama vile mtoto akikosa kulia, mtoto anaweza apata head brain damage which leads to cerebral palsy. Even the moment I was just explaining to people this what happened, wakambia mtoto kuna high chances ya kupata cerebral palsy. So when we came to Komarok, we did a lot of tests. We went for MRI, we went for brainwave, EEG. So we did a lot of things. Na hizi vitu zote zilikuwa zinafanywa na utaratibu. Even when I was in Komarok, I saw there is a difference between these people and the other place. Na baadaye sasa I came online after that time, nikatulia. I just wanted to know, am I the only one going through this or I'm just overreacting? So when I asked online, kauliza, hey, hizi vitu zimai hapenia mtoto wenyu ama nani amai hapenia na the same thing. A lot of people came out, they talked, they did everything. Wakatuambia this happened to us, ilikuwa hivi, wengine hata waka lose their kids. So I just say we were lucky. We were lucky because we reacted very fast.
So uko Komarok, were you paying ama mlikuwa mna partner na wao?
We paid because even baadaye wakati sasa waves zimekuja kuwa high, we were paying. Even in Haven I paid money. Because in Haven I paid like 166,000. Tukikuwa huko. Vile tumekuja Komarok, hata vile after mtoto amekuwa stabilized, I had to pay for admission and BU admission, which was, they were saying 50,000 was the deposit, but your time I had like 40,000. So I just paid the 40,000, mtoto akaadmitiwa na akaanza kuhave the treatment. So we were paying. The only thing that tukikuja sasa kuwa discharged, I talked to the Dr. Nyamu, I talked to him, akanipa discount. Akaniambia, hey, naelewa your situation this and this, so I was just given a discount.
Now the baby is here, ako sawa anaendelea poa. How is your relationship with now the hospital they Haven? It's called Haven, right? How kunaendaje saa hizi?
So we've never like, personally Mimi, I have never like wanted to even interact with them again, because number one, I also feel like you cannot discharge, awezi nitoa NBU direct to home. You understand? Because at a time tulikuwa Komarok, ndio naambia like unasikia Scott akisema Komarok kulikuwa na certain kulikuwa na protocol that is so mtoto ni amalize phenobab, akimaliza phenobab tuanza kumfunza the reflexes. Uwezi patiwa mtoto uende na mtoto home kama hajui kunyonya or anything, because mtoto atakulaji. So now they engaged a therapist who alikuwa anamfunza kunyonya nini. Alafu unafunzwa, like for me I was taught different ways of feeding her. Like akikata kusuckle, you can do the cup feeding. Like there was training before you even go home. And then after like sasa during as we are doing the training, mtoto ameletwa sapia bedside, afanye observation akiwa bedside. And then you see that like they did all the tests to rule out anything, ndio kama kuna kitu nafaa ititiwe instantly. Ndio nasikia walikuwa nasema do an MRI, do this so that they can see if there is anything we are going to start treating, tunaanza kutreat immediately akiwa hivi mdogo, which was not the same case for Haven. So my relationship and Haven is like hata sometimes because so you know tunapitanga hiyo barabara tukienda Komarok sasa cause Komarok ya Utawala. Sometimes I get there and I feel like it was literally the worst mistake I ever did. Yeah.
Hamjaitwa maybe kule waongeleshe. Umeitwa Scott?
I was to be called for a meeting, but sijaitwa meeting because after that, we had the first meeting in the hospital. After Nyasu deliver, we addressed the issues. Tukaambia we didn't enjoy the service, how she was treated and everything. Tukaambiwa tu au manaso walikuwa huko watakuja muongee. Hawakukuja that day. Walikuja ile siku tunakuwa discharged. So waliongea. Kwanza kuna even the thing walisema Nyasu walikuwa umbilical cord ilikuja. I was wondering hii kitu ilikuja aje because from just nowhere vile mtoto alitolewa tu hivi kwa womb, wanaambia angalia kitovu. So even that time sijui naangalia kitovu juu ya nini. So baadaye ndo wananiambia ati mtoto alikuja na umbilical cord.
Alafu according to them they were saying like the cord wasn't around her neck, alikuwa anakujanisha nayo like iko hapa like akisonga anasonga nayo. So hiyo time anatry kutoka cord inamzuia, like it wasn't around the neck, so cord inamzuia. Ati that's why it was something that they could have handled. That's why they didn't sasa peleka me for a CS as well.
So they were just coming up with those statements and everything.
Yeah.
So even that first meeting dischargewa kaongea, mimi nikaenda home. So vile tulikuja home tukarudi Komarok. I made the videos tulikuwa Komarok. They called me for another meeting. They just talked. Mimi nikamwambia right now I'm very emotional. I don't want to talk. I don't want to make any decision. So just give me time niende nishughulikie treatment. Tutakuwa na meeting nyingine. So from there hatujakuwa na meeting nyingine. They didn't call me for any meeting. Me, I've been making videos just to continue creating awareness. And through the videos I've made, we have a lot of people who watoto wao wamekufa, watoto wao wamedevelop the cerebral palsy. A lot of things has happened in the same facility. So mimi nimekuwa nikireceive tu hata saa hii watu bado wananitext wanaambia Scott hivi na hivi because one thing we were the influencers for that hospital. So we were representing them. So yeah, we were the face. So a lot of people even that hiyo time Nyasu alikuwa hapo kijifungua, there were people wamekuja na sema tumekuja hapa juu tumeona Scott na Nyasu tumefanya nini. So this hospital hakuna penye nimeitwa meeting, even the CEO hakuna penye nimekaa na watu wenyewe wakaniambia hivi. I was just talking to nurses, I was just talking to the normal people. So hiyo hospital till now we don't have any relationship. The last time we talked waliniambia tu they told me that I'm defaming them and I have to remove all the videos. They pull the videos either negative or positive because that was the last statement the marketing director told me. Aliniambia ati management imesema kama unataka meeting utoe videos zote zenye zinahusisha Haven either positive or negative. So positive ni zile za kwanza zile zenye tuliintroduce tukasema now tutawako wapi, tutazalia Haven, tukaonyesha the tour, tukaonyesha everything, hata vile Nyasu alikuwa amejifungua tukaonyesha. So those are the positive videos. So hizo positive wanasema you remove them and the negative one. Na wanasema na defame. Mimi nimekuwa social media space for a very long time hata before Nyasu kuja. So I know what defaming is. And there's no way I've went online nikasema Haven is a bad hospital. There's no way I've said people even to boycott the hospital. Everything I've been doing just public knowledge, just talking about what happened to us and to create awareness. Na hata watu wote wamekuja on my DM saying that this has happened in that hospital. But then there was a time I was thinking just to do things the low way, but nikaona I don't have money, I don't have anything. Right now I've spent a lot of money on my kid and I'm still spending money till right now. Jukuna hiyo therapy. Hata vile tulitoka Komarok juu the bill ingeendelea. Unajua ukikaa kukua hosted everything the bill is going up.
How much was it maybe by the time you were leaving the hospital?
So by the time I'm leaving the hospital, I paid, it was almost 250,000 or almost 300, because kuna vitu zingine tulikuwa tunafanya nje. Because kama MRI, there's certain tests we were going to get roots. So we were just all over the place. So the bill generally, it's almost 300 hapo 350, because kuna vitu tulikuwa tunafanya in-house na zingine hata kuna time tukatoka na ambulance, tukazunguka. There's a lot of things we were doing just for the kid to be okay. So sina hiyo exact figure, but we spend a lot of money there. So vile ilifika place tukaambiwa tu mtoto sasa kitu imebaki at least ako stable, kitu imebaki ni hiyo kunyonya, ndo sasa tuwa release. So mimi nikaenda nikaongea na daktari nikamwambia, hey, kama ni kunyonya tu inatubakisha hapa na huyu mtoto bado analala hapa, mnamhost, kuna hizo vitu, there's no any medication she was being given at that time. Ambia just release us, tuende home, therapy yakuwa nakuja kwa nyumba, tunaendelea na hizo therapy sessions. So ndo tukakuwa discharged, so therapy tunafanyanga kwa hao.
But sasa hiyo time already alikuwa shajua the bottle feeding. So alikuwa shashika bottle feeding. Tukamwambia kama ni kusuckle sub breast peke yake imebaki, just release us. We jua bottle feeding, we can hizo siku zenye afanyi therapy, we can be doing the bottle feeding. So tukakuja tukaendelea sana therapy in house. So she within a very short time after tumekamba hiyo alishikanga kunyonya very fast. But she's anaweza sema kwa nyonyo she's very clingy. Akishashika nyonyo atakai kutoka hapo. But now still, you know, there's still you know, when you kutolia when a baby is born, it's like pulling the brain backwards. You understand? So what happens is, I think kuna kwanga na delay in some things. Unaweza kuta mtoto kama anafaa kuroll sai, roll sai. You understand? So there is those milestones that are delayed. So for you to achieve them on time, there is therapy. You understand? So you still keep going with the therapy afterwards. So we're still doing it.
How long should it take, maybe, the therapy?
Because now, you know, milestones in achieve yangu differently. At 3 months anafaa maybe kuanza kuroll. At 4 months anafaa kuanza kuketi. So unaona ni kitu continuous. After every milestone, there's therapy for that milestone. Kama ni kutembea anafaa atembea this time. So kama ni speech, juu ni different therapies. Kuna speech therapy, kuna hiyo the suckling reflex, kuna hii therapy ya kuroll, ndio ansa kuketi, ni different milestones.
So she's doing
So
well?
she's doing perfectly.
Maybe as we wind up, labda what changed when the baby came? Right now najua mlikuwa peke yenu, but right now the baby's there. What do you feel changed? And people believe that marriage doesn't work. People have been together in marriage, let's say like almost 4 years. Do you believe in marriage? Marriage works according to you?
What has been different? I think also that phase that we went through, it to draw, I think, very, very close to each other. I was actually having a conversation with Scott yesterday. Nikimwambia pia kuna certain like trauma ikitu upatia mtu. Like hata yeye saa ingine kitoka sitaki atoke, because I am like, what, nikibaki na mtoto peke yangu, what if something happens? You understand? There's like kuna vile tu envious na psychology nini mental state ya mtu, like you feel like you're ama unajiuliza what if something happens to him and I'm left with the baby alone. You understand? There is a mental state that the niku puts you that is, so I feel like to draw like closer to each other, because now we are doing things together. We have to, these are our babies, so we have to be lazima tushikane. Lazima tushikane kabisa. So I think it has really drawn us close to each other, because we both want the same thing and it's a good life for our baby. And does marriage work? Yes, marriage works. Yes.
Okay, Scott.
I have one final question, and I know people will be asking this question, and for me at times I feel like it's quite personal. So wacha niweke ikuwa free, like it's a question you will choose to answer or not. Talking about what people were talking online, stories are all Cerebral, Palsy, nini vitu kama hizo. I don't know whether it's something that you would want to address.
Whether we sat down with Scott and said, mtoto ni wetu and this happened. You know, the first thing you have to tell yourself, the first stage of healing is acceptance. So we told ourselves, like we will, because we actually watch videos of babies with kwanza your time we were really looking at videos of babies with CP. So tukajiambia, if this and this happens, again atuwezi mdamp ni mtoto wetu, right? So we'll just hata sisi wenyewe tukikuwa hapo and the doctor like ayuko hapa kufanya therapy and everything, we do it ourselves. We take the time to go and research, because kama we feel like you can still beat it, like nothing is beatable. People with cancer have beat cancer, right? It is not, according to the MRI, there was no brain damage. But you know, I think pia inakwanga sometimes una juggle na kichwa yako, like kichwa yako inakwambia hivi, ni hizo tu intrusive thoughts and everything. They tell you this and they tell you that. But us, even as tukiwa hapa sisi wenyewe, we do therapy ourselves. We train ourselves. We don't wait for the doctor to come. So we try as much as possible. Hata tunasemanga sangine, hata kama atakuwa nayo, we will try and make her beat it. She's gonna beat it. She's a strong girl. She fought for this life. So life owes her. Yeah.